This message is to my nurse entrepreneur friends, specifically my empathic nurse entrepreneur friends who are either seriously thinking about starting a business or they've started a business in coaching, consulting, or care coordination, and they are having issues with imposter syndrome. So if you haven't heard of imposter syndrome is characterized by feeling like you're a fraud, feeling like you don't have the credentials to move forward, feeling like just a lot of self-doubt in terms of when you're doing something new, you're moving into the unknown. And you have this like paralyzing fear that you don't have what it takes. And so I have had to move through imposter syndrome myself as an entrepreneur, as a nurse entrepreneur, an empathic nurse entrepreneur. I know that it's possible, and I help other people move through imposter syndrome as well. So this is my encouragement for you today, and I'm going to give you some reflection tips, some journaling tips. You can write this down. I want you to write. So if you're a coach, for example, if you're a nurse gone coach and you are thinking you don't have what it takes to move forward in a business, or maybe you're scaling, and you're feeling like, you know, other people are, say, more extroverted than you. Other people are louder than you. Other people look fancier than you, for example. I want you to look back at your history. I want you to look back at how you've served as a nurse and how you're serving as a coach. And I want you to see how you've gotten people results. You've helped people get their results. I want you to look back on feedback that you've gotten from clients. So it's really helpful to get feedback from clients, because that's going to reassure you that you are a powerful, transformative coach. So look back on feedback that you've gotten from clients. Look back on your data. Your client started at this point in time and space, point A. By the time they were done working with you, where did they go? It is likely that you helped them a whole lot, even if it was little baby steps. Sometimes people move at different rates. Sometimes people have a lot of transformation, and some people they need to do a whole lot of under the surface work before you see the concrete transformation. So I want you to look back at the patients that you've served and what you have done to help them either get better or find some sort of solution or help them understand their diagnosis. So write that down. I want you to write down your skills, specifically with communication, your communication skills. So in my experience, what I was told over and over again in the hospital is, you explain things to me in a way that other people couldn't explain things to me. And so I have the ability to break down complicated concepts into simplified terminology so that most people can understand it. So with your communication, with your patients that you've taken care of in the hospital, what have they told you? That's good feedback. Thank you. I'm happy to see you. My nurse entrepreneur friends. So what have you been told? Have you been told that you can explain things very well? Have you been told that you're a good advocate? Have you been told that you follow up? Have you been told that you're timely in your communication? Take that feedback, because it's cumulative experience. So your nursing experience in the hospital is transferable into your coaching experience, your entrepreneur experience. How you communicate with patients in the hospital is going to be transferable as to how you communicate with your clients. So tip one, look at the transformation you've provided for your clients in the hospital and your coaching clients as well, to reassure yourself that you have what it takes to be an effective coach. Look at how well you communicate with your patients in the hospital and your clients. Ask for feedback from your clients. So every single client that I have taken care of, I have asked for feedback. I've asked for objective feedback and subjective feedback. And I use that feedback to learn and grow and improve myself. Okay? So 3 tips for you to move through imposter syndrome. Okay? You do have what it takes. The question is, do you have the passion? Do you have the burning desire? Hi. Do you have the burning desire to open, launch, and operate a coaching business, consulting business, or care coordination business as a nurse? As a business and not a hobby. So if you're interested in learning more, you can subscribe to this YouTube channel. It's Health Transformers Maine. You can go to my website, which is healthtransformersmaine.com. There's a tab called Entrepreneur Support there, and you can click the inquiry to ask for a business startup checklist or the business goals sheet. I'd be happy to provide that to you. If you're following my content and you're ready to take yourself seriously by getting coaching, business mentorship for empathic nurse entrepreneurs, you can again go to my website and inquire as to getting a coaching session with me. You can get started there. So I love you, my empathic nurse entrepreneur friends. You have what it takes. Believe in yourself. Take the next step. You'll be all right. I'll see you in the next one.